Welcome to Engage ICT. I'm Sarah Jane Crespo. In the Wichita area, we've been rolling with the pandemic punches for about 2 years now, and we're still here trying to keep healthy at a time when COVID cases have doubled in the last 2 weeks. So what's going on in our hospitals now? What COVID strain are we seeing the most of? And what's coming next? Tonight, we will discuss. So let's meet our panel. Dr. Sam Antonios of Ascension via Christi, Adrienne Byrne, Director of Sedgwick County Health, Teresa Lovelady, President and CEO of HealthCore Clinic, Dr. Thomas Moore of the Infectious Disease Consultants of Kansas, and Dr. Timothy Williamson of University of Kansas Health System. Thank you and welcome to you all. Dr. Antonios, I'd like to start with you. You're Chief Clinical Officer for Ascension via Christi, a statewide role. Let's talk first about what kind of situation our hospitals are in today. What are our care providers dealing with, and are there shortages right now?
Good evening, Sarah, and thank you for the panel. We've been sharing with the community that over the last several weeks has been a significant rise in the number of cases in our state and our communities. And like you mentioned, we're a statewide health system. In all of our hospitals, we have seen an increase in the number of hospitalizations. Some of it started out with Delta, but then as Delta was starting to go down, it was overtaken by Omicron as a new variant that has really driven hospitalizations even past last year's peaks. And so over the last several weeks, we've seen numbers of hospitalized patients that was even higher than the peak from 2020. Same thing happened in urgent cares. Same thing happened in emergency rooms. We are this week, I dare say a little bit better because we have noticed a slight decrease from last week, which is very encouraging. And so that leads us to believe that maybe we have reached a peak and we're starting to decline. That was only a mild decline, though, probably about anywhere 6 to 7%, but we'll take it. Anything
because at least it's a decrease and
it's not an increase.
It's not an increase,
so
right?
From that regard, we'll take it.
Yeah, absolutely. And do you have, are there like reliable patterns as far as how far behind the curve we are from, eastern side of the country and, on the wave of Omicron as they see it coming down? Can we tell, is it reliable to kind of follow that pattern? Does it tend to stay the same?
Obviously it's always a risky business to try to predict the future, but if we do compare what has happened in other countries globally, but also what has happened in other states, generally after a peak, there's a decline. It does take a time and it is typically symmetrical to the increase. And so it's goes up, but then it needs probably the same amount of time to go down. I did want to mention something that's important. Hospital patients who are in the hospital, it's somewhat unpredictable to know how long they're going to have to be there. Some people are not that ill and they may have a short length of stay, but just like in previous waves, we have unfortunately seen people who require weeks, 2, 3, 4, sometimes 6 weeks being in the hospital as they're recovering from, depends on the type of illness that they have acquired due to COVID-19. We anticipate probably in the next 2-3 weeks, we'll see a continual decline. But obviously, there's a lot of caveat in trying to predict the future, and we've all been proven wrong in the past as well.
And I say that the evidence from other countries is showing that the Omicron wave lasts about 2 months. So hopefully we're going to be approaching that soon.
Okay, very good. Well, thank you very much. Dr. Williamson, I'd like to come to you next. Can you talk to us about booster shots? Give us the scoop.
Yeah, and so I think one of the things that and thank you so much for having me join, but I think one of the things that we've seen that's really critically important is that booster shot. You know, we've not really seen our numbers here in Kansas City peak yet, and we're every day it feels like we're hitting a new high in terms of our hospitalizations. We've got maybe a quarter of our entire hospital filled with COVID patients at the moment, and the deaths are still there. You know, we had 6 deaths yesterday, and we've had more, almost over double the amount of deaths so far in January than we did in December from COVID. So we know that it's still very much a problem. But one of the consistent patterns is not only are folks that are hospitalized with severe illness or dying, these are folks who maybe got vaccinated, but it was in March or April of 21, and they're way past 5 or 6 months from the booster. And so that it is, we're seeing a lot of folks who may have had those first, even those first 2 vaccinations, which is important, but never got around to getting their booster. So we're highly encouraging everyone who has been vaccinated, if for whatever reason you haven't got it yet, now's the perfect time to do that.
And Sarah, I'll also add to what Dr. Williamson has shared in regards to the booster specifically. We're starting to see some very interesting data come in the literature. Specifically last Friday, the CDC published, I thought, a very informative report where they compared what happened and how many people got sick, either if they're unvaccinated, if they have had double doses of the vaccine, so fully vaccinated, but it's more than 180 days ago, or less than 180 days, and then if people have had 3 doses of the vaccine, so they've had boosters. And not surprisingly, we find that the ratios of who got sick and who got hospitalized follows that pattern and that order. So obviously the people who have needed hospitalization by far have been the hospitalized, and then breakthrough infections occurred more frequently with people who have been more than 180 days been vaccinated, followed by the people who have recently been vaccinated, and then the least hospitalizations, if any, has occurred with people who have had a booster. So more and more we're learning that about the importance of boosters, and we've seen it also in practice.
Very good. Thank you. I have our first question coming in from Facebook, but I want to ask a personal question first, because I myself had a breakthrough case and did not have a booster shot prior to that. So what I'm wondering is, should people like me who have recovered from COVID, should they go and get a booster?
I'll jump in here. This is Dr. Moore. Yeah, I would say yes. I mean, the thing is that the data, when the data are examined with regard to individuals who are infected first and then undergo their initial series of the vaccine, they actually seem to have developed what's known as sort of super immunity. They have the strongest immunity against the virus of all. For those that have had the 2 shots, then get infected, it's still recommended that you pursue a booster. You kind of had your booster with the recent infection, but for a variety of reasons, most of which is that we really don't know how robust the response is for breakthrough cases, and or more specifically, how long it will last. It is generally recommended that you get your booster. Recent data that were just published regarding the Pfizer vaccine show that those who have had exactly the situation you present, that is having had the initial series, then getting sick and with the virus and then getting booster, they actually do exceptionally well with subsequent exposures.
Thank you. Okay, let me get to Elaine's question from Facebook. She says, how has the testing shortage affected our ability to assess where we are in this surge?
I'll jump in there. Last week, I think everybody was at their capacity with people being able to get in, but that was a very short period of time, because since that time, with the help of Kansas National Guard, and we pulled staff from other programs again, we have added to our site on East Harry. That is the 4115 East Harry. For anyone that's old enough, it used to be Harry Mall, but we are testing there, and now are open on Sundays there. And then we have added a drive-through site as of last Saturday at the Wichita Transit, which is 777 East Waterman, and that is open expanded hours 2:30 to 7 and Saturday 8 to 5. So there are evening hours, and I'll just put in a plug for the hospitals. It is really important that people do not go to the hospitals, the emergency departments, to get tested. I know it's been difficult when there hasn't always been after hours, but we do have now that 7 o'clock until 7 and weekend hours.
Thank you. Adrienne, I'd like
one thing.
Go
I was
ahead.
just going to say real quick. I think one thing it highlights too is testing has kind of picked back up, but we know that there are thousands and thousands of home tests being done, and those aren't captured in the cases. So we know that the cases have to be thousands and thousands more than we actually have, just because of the number of home tests that don't get reported anywhere. And just a reminder, if you have a home test that's positive, then treat that as a positive. But if you have a home test that's negative and you keep having symptoms, then you either need to repeat that home test or get a PCR. It sounds like some really great testing opportunities.
I definitely want to come back to the topic of tests and different kinds of tests in a few moments. But Adrienne, I want to come back to you and ask the question of the Pfizer COVID pill. I've heard that it is in Wichita. I'm wondering how one gets it. Yeah, go ahead.
I can say, and some of the doctors might have information too, but I can say as of the 21st of January, there were 0 available Paxlovid in courses in Sedgwick County. They are extremely limited supply all over the country. Now, Health and Human Services, and it's a really long link, and so the best thing people can do is go to the Department of Health and Human Services. They have a COVID-19 therapeutics locator that shows where the current available and allocated treatments are in Sedgwick County, as well as what pharmacies. But again, as of last week, there were 0.
So I was fortunate enough to able to get a patient who had a breakthrough infection and who was heavily immunosuppressed, a dose of a course of treatment of the Paxlovid. As I understood it, there's only one. There's the Walmart pharmacy on Pawnee in Wichita is the one that has it. They get 120 doses every so often. That's as according to the HHS site. How often they get their shipments is variable because of supply issues. But needless to say, they go extraordinarily quickly, as you just heard.
So but a doctor prescribes it, and then the patient.
That's correct. You have to have a physician who will prescribe it. Now, the cost to the patient is free. I mean, it's like many things. It's that have happened with the COVID pandemic. It's already paid for by your tax dollars. So there's no barrier for the patient to get it other than having a physician prescribe it.
Thank you, Dr. Moore. And Dr. Moore, when do you actually think the pandemic might be heading out the door? Or is the best that we can hope for at this point that COVID becomes endemic?
Let me get my crystal ball.
I'd like for you all to get out your crystal balls, actually.
Well, the magic 8 balls, no. So it's really impossible to predict, but there are some data that do inform our understanding of this. So just in general, for example, the United Kingdom is about, what their experience is with COVID is about 2 weeks ahead of what the United States experience is on average. And they've already started to experience a decline in their cases. Now, that's a different population because they have a higher uptake of vaccines, and that's they're not, sort of apples to oranges. But when for example, the city of Boston, they examined their wastewater for COVID, and what they found is what has been reported in South Africa and the United Kingdom, where the Omicron surge lasts about 4 weeks. That is, you get a dramatic uprise in cases and then similarly a dramatic fall. Why it falls is not clear, but one of the current thoughts is that there are so many people that are infected in such a short period of time that it tends to burn itself out. I think that's a misleading statement to some extent, because although the Omicron, the development of, thankfully, a so far less virulent strain of COVID that's much more infectious, may hasten the end of the pandemic. It's just going to slip us into the endemic phase, and I have no, I have no data on which to say it's going to end on a specific date. But I will say that it is generally believed that, given the exceptionally high rate of infection that we're experiencing right now, where as Dr. Williamson alluded to, I mean, really in Sedgwick County, we have 1 out of 3 people being tested officially being positive. That's exceptionally high. And we, as Dr. Williamson said, we really don't know how many people are being tested or who are positive at home. I can tell you just from the hospital census, as Dr. Antonio's mentioned, it's exceptionally high. Having said that, I do think that the number of cases with enough people getting infected, there will be a, my guess is that as the weather warms and more specifically as kids get out of school, my guess is it'll slow down around March and then peter out to an endemic phase around May. That's, but you know, don't buy a lottery ticket with that.
Right, right. Well, okay. No,
and I was
go
going to
ahead.
add, Sarah, to you know, I think everybody almost agrees now that we're headed towards an endemic phase. It's just when it starts, and you know, that means that COVID will always exist, which means that we're always going to have the virus circulating. The degree of which will be variable over time, but the virus will continue to circulate, and unfortunately, we will continue to have people who get admitted to the hospital. The way we can reduce that number, either in immunocompetent or immunocompromised patients, will be with vaccines and boosters. We still don't know what the I guess long-term vaccine regimen will be. Is it going to be like the flu every year? It's 1 dose, maybe every year it's 2 doses. You know, I don't know, and I'm not sure what the future will hold from that regard. But we're probably headed to a world where we have to supplement our immune system, because the immunity wanes over time. We know that. We've seen it. It wanes over time with some degree of vaccination on a yearly basis or even more. So we're headed towards an endemic phase at one point in the future.
I do want to understand, though, really what would kind of tip the scale one way or the other way. If Omicron is so virulent that it has this incredible effect and burns itself all out, you know, could it end the pandemic by being so contagious and everyone just gets it and then it's gone? Or like, what is it that tips it into endemic? Do you understand what I'm asking?
Yeah. And well, I guess what I would say is that, you know, the current strain of the virus is so highly contagious that, you know, how you're going to react to it, of course, is completely unpredictable. And that's, and I'd be remiss if I didn't sound like Johnny One Note here and just say, please, for the love of God, get vaccinated if you have not been vaccinated. That's really going to be your way of getting protecting yourself, and it'll help burn this out. So what is unknown is what the rest of the world is doing. If we can get the rest of the world vaccinated, then we could we could stop the development of other strains, more virulent, more contagious strains. That's the great unknown. So what's known in this country is the more people we get vaccinated and the more people who are exposed to the virus, the less likely we are to get these surges. Mm-hmm. When will that happen? It's going to be a numbers game. Perhaps Adrienne can say what's the there's a cutoff between where you say it's no longer a pandemic and it's now endemic.
Well, that is a good question itself, you know, that we're looking at, because there's a lot of factors in there. But we were talking with Dr. Menz the other day, and he had a similar thought to what you did in regards to by the summer, between vaccination and more people having natural immunity, that would be going into that endemic phase because of the numbers dropping. Right now, we're anywhere between 1,000 and 2,000 new cases a day. And it definitely won't be that.
And Dr. Moores, I think your point, I'm so sorry, but I think your point was really good, that this is a global, you know, we treat this or talk about it so often as in terms of Wichita or Kansas City or Kansas or the US, but this is really a global problem that we're all in together. And as long as we don't or can't get vaccination worldwide, the opportunity for hotspots for new variants to take hold is so we're really all in this together globally.
Mm-hmm. Teresa, were you going to add something?
Yes, I was going to say, and we must acknowledge that there is still fear and resistance against vaccination for whatever reason, and still making certain that we provide opportunities for individuals to express and show what their concerns are, so they can go and get vaccinated. I can tell you that the community health centers across the state, there's 21 of us across the state of Kansas, and Community health centers, similar to HealthCore Clinic, we serve about 1 in 10 Kansans. One of the things that we've all worked on is to make certain that that we're there for individuals who are uninsured, underserved, regardless of their ability to pay. I think what's really interesting when we think about this pandemic and how it's touched different populations and communities, I always imagine that individual that gets a positive test, whether they test themselves at home or whether they got a positive text message that you're positive and they're experiencing symptoms and they don't have established care with a primary care provider. They don't necessarily want to go to the emergency room or hospital because they don't want that high bill. So they wait until it's too late. They have vulnerable family members at home, whether they're younger kids or whether they're seniors. They're feeling symptomatic. You know, what do we expect that individual to do? Do we expect them to go out and go to work, to spread it in the community, you know, different things in that way? One thing I appreciate about what our community health centers have been able to do is being able to open our doors and respond in ways. For instance, at HealthCore, we've opened up our doors to create respiratory clinics where we've been able to have not only our patients, but anyone from the community to come in if they're experiencing symptoms, whether they're positive, they're not positive, they got an at-home test, they got a positive test result, and to come in and get with a medical provider and gain access to pharmaceuticals and support so that it could relieve kind of our emergency rooms and kind of help out in that way as well. And really educate our community on the need for vaccination and then provide vaccination clinics in a way that they're in a trusted environment and or referring them over to the health departments across the state and working in collaboration and partnership. But I do think we have to make certain that we acknowledge that there's still that level of fear and resistance in our community with the vaccine. And until we, like we said, that it's global, but we also have hotspots in our own community that we have to address and really take care of our underserved and individuals in our community that really need that added support and love and compassionate care.
Well, I would just interject this. There is no question that this pandemic has shown a very harsh light on the tremendous disparities in healthcare access, as well as healthcare affordability. And those are things that I'd like to believe we will be able to address, and we'll be able to now that the attention has been paid to these things, which have been largely ignored, maybe we can have some action on those.
Teresa, how do you think that the way HealthCore has served different communities has changed over the course of the pandemic? What have been the biggest changes that you guys have gone through?
Well, I would say, well, I'll give you an example. Last year we served 11,134 thousand individuals, and that was an increase of about approximately 2,000 individuals from the year before and an additional 1,500 from the previous year. We've had over 38,000 visits. We've converted over to telehealth, which is something we never did before. 2 years ago, we didn't have telehealth visits. We serve our patients in the parking lot almost. We've converted half of our facility to a respiratory clinic, and we've dedicated half of our medical provider team to really providing respiratory care visits within the facility. We've hired 20 additional staff individuals that are truly focused on working with our respiratory working towards helping and supporting COVID types of interventions, whether it's testing, outreach, vaccination, education. We brought on a food pantry within our facility because we do serve a targeted community where access to food has been extremely tough during this situation. So we've partnered with the Kansas Food Bank. Personally, last year we administered 5,330 vaccines here at the clinic to the community. And again, we're talking about a very hard to serve community that's struggling with many health disparities. Overall, we've provided over $2.2 million in uncompensated charitable care to the community, not only for medical and behavioral health services, but substance abuse services and dental services and access to pharmaceutical services. Last year, about 5,200 of our patients, they weren't of the encounters we had, they weren't even our patients. These were just community members who needed support and access, whether they just needed help, and we were there to help them. We opened up an education room in our clinic so we can help people gain access to unemployment and help kids print out their homework. I mean, just so many things we did just in response to the pandemic, because there was a need in our community. And we saw that with even like our diabetic patients, they weren't able to get in for care, and creating opportunities so they can have lab-only visits. I mean, just so many things we had to really pivot and be responsive to meet the needs, the growing needs of our community.
Thank you. Yeah, sounds like there was a lot of pivoting.
And not just HealthCore. I would say Grace Med, Hunter Health, Health Partnerships, all the community health centers. You know, we've really been working together to create that safety net across all of Kansas, so that no Kansan is left behind during this pandemic.
And Sarah, you know, something Dr. Moore has mentioned, I guess I would like to also echo, to advocate for more focus on the fact that the pandemic did truly reveal disparities in both outcomes, and how people have experienced it. It hasn't been equal, and we hope that there's more focus on how in the future we can have some solutions to the problems that we face in a lot of the vulnerable communities have experienced throughout the pandemic.
Thank you. Adrienne, I would like to come back to you. And so nationally, we have about, I think, 251 million Americans who have had at least one dose of a COVID vaccine. How are we doing as far as the number of people that are vaccinated and boosted in Sedgwick County, or one or the other? Or I don't know if you have all of that data.
I can give you both. The percentage of the eligible population, and that's 5 and older, who are fully vaccinated is 54.2%. And that's either 2 doses of Pfizer, Moderna, or the 1-shot Johnson & Johnson. Now, boosting is a tad different. There's a lot of people that are eligible for getting a booster that have not gotten a booster. So of the eligible population, 21.7 have received either a 3rd dose or a booster. We're not able to separate those two in the state system. So there's a lot of boosting that we are yet hoping to do.
That 20% is somewhat low, in my opinion, on the boosters. I do hope that number goes up. I think it's
absolutely
necessary.
Dr. Antonios, can you tell us what that, if, I don't know if you would know how that would compare to the Kansas numbers, or Adrienne, if you would have that number, how we compare statewide?
I do. Let's see. No, I don't. Well,
If you
yes,
find
so
it later, well, okay, go ahead.
for Kansas, it's 52.3% are fully vaccinated, and the United States, it's 64% are fully vaccinated. Now, in the US, there are some states that are higher than 52%, and then there are some states that are lower than 52%.
I was just going to interject here about that, is that just from Wesley alone, and this is, you know, it has to do with this, 88% of the patients that are hospitalized on the floor are unvaccinated. 95% of our ICU patients are unvaccinated, and 100% of our ventilated patients are unvaccinated. So that's just additional information for that.
Yeah, that is illuminating.
Oh,
go ahead.
I was going to say, Sarah, that's one of the reasons why I think we have to be really strategic and creative about reaching out to those populations that we know are not vaccinated. And an example of what we're doing with our international patients or our refugee patients here at HealthCore, we know we had a huge influx of Afghani individuals into our community, and we've had about 200 Afghanis resettle into our community. And so we've held special clinics where we've just outreach to that targeted community. And so that's one of the things we're doing. We're identifying targeted communities, and we're really going into those communities with different types of wording and language, and we're really taking it to them and encouraging them to come in and get vaccinated. We're working with FEAR, what is it? Adrienne, you might know this one. It's FEAR. I'm going to get Facts Not Fear ICT. It's an organization here in Wichita that's really targeting the African American, the Hispanic, Asian, and Native American populations to really go into those targeted communities with education, information about vaccines, and just health literacy and other types of information to really start drilling down and getting into what some of the fear is so that we can get more individuals vaccinated. And I think that's something we're going to have to do because, as Dr. Moore shared, it's the individuals that's unvaccinated that's really at this point, they're the sickest, and they're taking up the space in the hospitals, to be completely honest, that if you get hit by a car, you're in trouble, or if you need some routine regular care, you're in trouble, so until we all are able to work together, starting with, wherever we start, we just have to really collaborate and coordinate and start working together to get through this together as a village. We all have to work.
That definitely is part of the solution. We have worked a lot with the Black Nurses Association and some with HealthCore to be able to reach more of the underserved community. We have done so many mobile clinics looking at zip codes that are the high social vulnerability index, and have gone to various churches, and that has been very successful, and we wouldn't have been able to do a lot of that without HealthCore's help and the Black Nurses Association in particular. That's made a big difference.
I think the other cohort we don't want to lose sight of, and all those are incredibly important, and Adrienne, you may know the numbers for Sedgwick or Kansas, but is that 5 to 18? It seems like that uptake in that particular group, which is vulnerable, is, and this particular, the area of Omicron is hitting children at a higher rate, with more hospitalizations, more long-term inflammatory syndrome, more term other stuff. And I think I've seen numbers in some groups of less than 20% for vaccination there. So I think that as kind of tackling all of those myriad of cohorts, which are incredibly important, I want to kind of put a plug in for the 5 to 18 as well, because unfortunately they're at risk of a lot of the same things.
I would second that. The 5 to 18 group is also a group that we need to kind of encourage parents to really learn the facts. That's probably advice for everyone, not just that group, that to seek out the facts from reliable sources and not from social media. And because there's been a lot of misinformation that has led people to be fearful, but the facts are still very strong and show benefits across all age groups for vaccinations.
And the source that you would encourage people visit, CDC or?
Well, definitely people need to start with their physician, but there are sources such as the CDC. KDHE has actually some also online resources. I know Sedgwick County has also resources. The most medical societies have published online resources that are reliable. And the important thing is for people to be somewhat skeptical if they see a claim that is categorical in nature, and ask around and not believe the first thing they see, especially if it's aiming to make them fearful of the vaccine.
Okay. For those just joining us, I'm Sarah Jane Crespo, and this is Engage ICT. We're talking about COVID-19 in our community 2 years into the pandemic, with Dr. Sam Antonios of Ascension via Christi, Adrienne Byrne, Director of Sedgwick County Health, Teresa Lovelady, President and CEO of HealthCore Clinic, Dr. Thomas Moore of the Infectious Disease Consultants of Kansas, and Dr. Timothy Williamson of University of Kansas Health System. I would like to play a clip here from a news story done by my colleague, Suzanne Perez, and I would like to ask Dr. Antonios to respond to this after we listen.
Dr. Kim McGow is Chief Medical Officer for HCA Midwest Health in Overland Park. She says record numbers of COVID infections and staff shortages mean her hospital and others may soon have to adopt the types of triage strategies they'd use in wartime.
Which is deciding who gets care and who does not, who gets a chance at living and who is left to die. And that is really dire, but I think it's important to say that is how bad it could get.
Dr. Antonios, don't think that that's the case here at the moment. Do you feel like we could get there before it starts to get better, or are you really hopeful that we're slipping into that decline?
You know, I sure hope not. We definitely are not in that situation right now. We're doing any kind of triage like the one that you have heard in the audio. I know that was one of the fears that was, you know, Dr. McCow had mentioned on the call today in our hospitals. Through a lot of hard work, and our staff are really stepping up in really admirable ways. We have been able to manage through the influx of patients, and so we have been able to avoid such a situation. I think it's always a possibility, but thankfully I actually think that since we're starting to see somewhat of a peak, at least in our area, and hopeful that the numbers are going to start to go down, and maybe some of those numbers have already gotten to start to go down, we hope that we don't achieve that, or I'm sorry, we don't reach such a situation. Thank God we're not in that position right now.
Is there anything that we as a community can do to kind of make sure that we don't get there? Or is it just, I mean, are you still recommending that people mostly live like hermits right now? Or is the message really just to get vaccinated and boosted if you haven't been?
Yeah, definitely not like hermits. I don't think anybody has ever said that. Well, all what we have asked people to do is just to do the reasonable steps in order to prevent the transmission of the disease. So if someone is not vaccinated, to get vaccinated. If someone is not boosted, to get a booster. If someone knows that they're falling ill, to actually get tested and avoid being others. And then in circumstances where there are crowds, or there are people who you don't know how their status is, to actually wear a mask, specifically indoors. So it's the same stuff. Now, really, the life can continue with all of those small precautions. There's one more thing that I ask people to do, and I think I mentioned that before, is to be kind. All industries, everywhere in the country, there's been people who have been falling sick and shortages of staff. Specifically inside clinics and hospitals, people have been trying to do their best with their colleagues out sick, and so working with less people. And kindness and grace is important as well, which is free.
Thank you. I have a couple more questions that have come in from Facebook. This one from Debbie. She wants to know how soon should a person get a booster if their first shot was Johnson & Johnson and 6 months ago had Pfizer? So if they had J&J and then more recently a Pfizer shot, when should they get boosted?
The general, right, go ahead, I'm sorry, Adrienne.
Well, I'm just going to say with the Johnson & Johnson, it's 2 months after that initial, and then the booster is the same as for anyone else, and that is 5 months now.
Okay.
And, you know, and I would like to stress that I know with so many breakthrough cases for people that were concerned or mistrustful or doubtful, that it's fueled some of that. But it's important to know that the vaccine, even though there are breakthrough cases, 2 of my 3 children had breakthrough cases, that the vaccine is doing its job. It's preventing people from severe disease, not 100%, but by and large, it's doing its job from keeping people from hospitalization and death.
Thank you, Adrienne. Ryan from Facebook asks for Teresa to talk a little bit more about what community clinics in Wichita are doing and how they are working with other organizations such as hospitals in the county. You talked about this a little bit a few moments ago, but are there any other projects that you would like to elaborate on a little bit?
Well, I know each of the health centers, we've been very fortunate that HRSA, our federal kind of funder, is sending N95 masks to us so that we can disseminate into the community, as well as other resources and materials so that we can kind of test kits and other things that we can get out into the community. So we are working to get those disseminated. Once we get more, we'll get them out into the community. We have also opened up our respiratory clinic. So I know at HealthCore we have 48 scheduled appointments every day. You can call the clinic. I know at HealthCore, we're 316-691-0249 if you want to schedule an appointment. If you feel like you have COVID-like symptoms and you don't have an established care with a primary care provider, I know you can call any of the community health centers in your local community. No matter where you're at in Kansas, call them and they'll try their best to get you in, whether you have insurance or not. At HealthCore, we do have a walk-in vaccination clinic, so you can sit down and talk with the medical provider about the vaccine if it's right for you. Our clinics are for Pfizer. We have it on Thursdays from 3 to 5:30, and during that time, we really focus on kids. Anybody can come in for Pfizer, but it's kind of our goal to get more children boosted. So I know one of our wonderful doctors on the line talked about filling that gap of getting our parents motivated to get our children vaccinated. So we do reach out to schools and try to get our parents encouraged to get our kids vaccinated. And on Fridays from 9 to 11:30, we have Moderna vaccines. You could walk in and get vaccinated as well. And I know both Hunter Health and Grace Med, they also have vaccination clinics, and they have testing, and they have those services as well. So you can connect to those community health centers and across the state. That's kind of our goal. We're here to serve.
Thank you. Dr. Moore, I'm curious. I saw that I believe it was the Washington Post yesterday showed that the Omicron variant accounts for, I want to say like 99% of COVID cases nationally at the moment. And I was wondering what the predominant strain of COVID is in the Wichita area right now, if it's similarly something so extremely leaning into Omicron. And is there any indication of that changing into some other strain that's coming down the line?
So 4 weeks ago, I mean, it was 5 weeks ago, the Omicron cases statewide were like 10%. Starting 2.5 weeks ago, it's 100%. Maybe it was a little before that. Yeah, and virtually all cases that are being tested now that they're identifying are Omicron. Now, to be fair, they're not testing all cases. It's just physically, it's not feasible to do so. But of the sampling that has been done for at least the last 2 weeks, so 100% of all the cases have been Omicron.
Wow.
We're still seeing a little bit of Delta from what KDHE is reporting, but yes, by and large, it is just all Omicron.
So, and this, keep in mind, this fell just on top of the Delta surge. So we were in the middle of a Delta surge that was filling up the hospital, and then the Omicron came along. And of course, now that there's been identification of another Omicron strain, which is even more contagious, if that's if that's able to be comprehended, that's more contagious than the current circulating strain of Omicron. And for relative comparison, I want to make sure that your viewers are aware. The measles virus is one of the most contagious viruses known to man. And by that, I mean, a single person will infect 14 other people. These viruses that we're seeing now with COVID, the Omicron strains, are more infectious than that. So it's only a matter of time before the virus finds you. There will be populations, very small populations, that are able to, somehow escape getting the virus. But by and large, this virus will find you. And again, although it is, I wish, I don't want to give the false reassurance that Omicron is it's certainly less virulent than Delta, but that doesn't mean it's going to be less virulent in you. You really don't know what's going to happen. And that's just, again, why we beat the drum and try to get as many people vaccinated as possible.
And why it's important not to rely on natural immunity, because I know that a lot of people say, I'll just wait until I get it. Well, Omicron has shown, and we've reduced that 6-month span for natural immunity as far as quarantine to 3 months, because we know that Omicron being fully vaccinated and natural immunity isn't enough. So that boosting is really important.
And something that Dr. Moore mentioned is important to emphasize. There's been reports that Omicron can cause a milder disease, and that is correct in many people. However, there are still a a lot of patients who are getting the same virus, the same Omicron, and they're getting very ill, they're getting on a ventilator, and then they are dying. So the fact that in some people it has caused mild disease, and on the aggregate, that's true, it doesn't mean that somehow in everybody it's causing the same course of disease, and everybody's going to be different, mostly dependent on the level of immunity that someone has had built up.
Yeah. Don't we still
obviously
have,
depends on the vaccine.
isn't there still something like 2,000 Americans dying a day right now,
Right.
somewhere around there?
Yep, and even a mild disease, when it's in a very large number of people, it can cause a death. A small fraction of a very large number is still a very large number in the absolute.
Just for a comparison, we talk about the largest loss of life in one day being the 9/11 attacks in 20 years ago. We're losing that number of people every day to COVID, and I wish it's hard for people to. It's easy for people to think about it as some other, as an abstract concept, and it's been my experience. Limited as it may be, with regard to getting the vaccine. Most people aren't interested in getting the vaccine at this point unless they know somebody who got it or they themselves got it and they know how sick they can be. We don't want to get to that point, but anyway.
And I think what's scary along those lines is we haven't seen the peak in hospitalizations, may not for a couple of weeks. We may not see the peak in deaths for a couple of weeks after that. So I don't think we've even really seen the total potential for destruction that still may lie ahead, and not to also forget all those other sorts of long haul and long-term complications that can still happen with Omicron, again, depending on an individual basis. So I think folks who kind of take it lightly, to both to everyone's points, is you kind of do so at your own peril, because in some people it may be mild, particularly if you're vaccinated and boosted, but in other folks it can be deadly or still have long-term consequences. So certainly would encourage folks not to think this is over, and there are some bright spots ahead, but partly that depends on what we do now in terms of masking, vaccination, avoiding those in-person, indoor, large events, et cetera.
And
Dr. William, I'm sorry. Go ahead, Adrienne.
One of the things that people say that keeps them from getting vaccinated, and I was just talking with an individual about this the other day on the phone, that they don't know what the long-term consequences of the vaccine might be. And one of the ways that I respond, in addition to saying it's difficult not being able to, look into a crystal ball and know what's going to happen on down the road. But we know for certain that there are long-term effects. I've talked to and seen so many healthy people that had COVID, and younger people, 20s, 30s, that have had COVID that now have pulmonary problems. And I don't know how long those are going to last, but they're not back to what they were prior to getting COVID, and they had it last year. And I imagine the doctors on the call could give lots of stories about the long-term, short-term, long-term, and long-term consequences that people are experiencing because of having COVID.
I have another question from someone on Facebook who kind of wants you all to address a little bit more deeply about long-term consequences of COVID. And she says that she is vaccinated and boosted, but just wants to know a little bit more about the risks of long COVID for someone who still did all the recommended things.
Sarah, I'm just going to say thank you to that person first. Thank you for doing what we've asked them to do. And I'll let the doctors go into more specific details. But one of the things that I wanted to point out is that the long-term effect to me of not being boosted or vaccinated at this point is that, are we going to wait for the next variant to come? And then it's going to catch you unvaccinated. Mm-hmm. And because more people are getting vaccinated, you're going to be the one that the virus is going to I'm just going to be very in layman terminology, the virus is going to jump all over you because you're going to be open season for the next variant because you're not vaccinated and you're not boosted. And so if that happens, you're going to be the one most likely to be in the hospital, most likely to be on a ventilator, most likely to have your family crying, your family, you're going to be the one that's most at risk. So to me, the greatest concern now is that if you can, if you're able, get vaccinated, get boosted. I know that there has been a lot of people don't want to trust people now, and there's been a lot of changes, and there's been a lot of, we're getting new data, we're getting new information, so we have to constantly adjust what we're doing in the medical field, and we need the community to trust the medical community at this point, that we're doing our very best to take care of our neighbors and our families and our friends. So I'll stop right there and let our doctors answer more specifically that question, but just get vaccinated, get boosted.
Thank you, Teresa. Anyone else want to respond to that?
I can't say it any better than that.
Awesome. Okay.
I think that's awesome. And I think to the question about the long haul syndrome, I think if you have all those things and you have symptomatic or mild disease, you're probably not going to have substantial long-term consequences. But the ones who do, often it is long-term breathing problems or neurologic problems, fuzzy, kind of a fuzzy mind sort of thing, and just that shortness of breath or cough that lasts for months on end. So I suspect they're in Wichita as well, our so-called long haul clinics are pretty full, and doing all those things that were pointed out really will help minimize the chance that you need one of those types of clinics.
Let's go back to the subject of tests. I would really love for you all to break down for us the different types of COVID tests that are out there. So what is the difference between the PCR test, those different drugstore tests, and then that brain touching nasal test that's done in the doctor's office? And I feel like I've had all of them, but I don't know why they are different, how they're different.
If your brain didn't get tickled, then they didn't do the test right.
It did. It was awful.
Let me take a stab at this, Sarah, just real quick. So there's in hospitals and most clinic for diagnosis, we mostly rely on the PCR test, which is basically a test that tries to search for a small fragment of the virus's RNA. The test tries to, through a machine, try to detect a fragment of the virus itself, the virus's RNA, in the test. That one actually,
saliva test.
And that it's the same one. The sample may come from saliva, and it requires specific type of instrumentation to deal with saliva. The sample may come from the nose or deep in the nose, which is what you're referring to. And so every machine kind of wants to get a certain amount of sampling, which is why you've got the saliva or the nose. But the technology itself still is trying to find a fragment of the RNA of the virus in a sample. Not long ago, there were, in order to actually try to have people get a quicker result, there's something called the Antigen Test that was created. It's slightly less sensitive than a PCR. That one is not trying to detect a fraction of the RNA of the virus. It's trying to detect an actual fragment of the virus itself. And it's an antigen. Antigen is just something that comes in a virus or a bacteria, something that the body can recognize as foreign. So one is trying to detect a piece of, RNA. The other one is trying to detect a piece of the virus itself. It's a little bit less sensitive. However, it is available in a packet that people can get at home. So it provides expediency, even if it's all slightly less sensitive. And each have its place. The other test that has existed for a while and frankly is not necessarily in use in most places for diagnosis purposes is something called the antibody test. And that's really after someone has already been infected, they've developed antibody, you can test to see if they have them or not. There's a lot of those. They're really not utilized in the acute phase of management of the disease.
Should they be used more for some purpose, or?
Those are generally reserved for clinicians who have specific questions they're trying to answer on a patient. And even those, the instrumentation for those to be super accurate varies by location. There's a lot that have been on the market that can't really tell you if that was COVID-19 or the new coronavirus versus an older coronavirus, which has already existed. And so that's why it depends on the type of machinery that exists as to the level of accuracy of those. That's why they're reserved for doctors like Dr. Moore, who sometimes may want to check on something. They may decide to get that. But for the purpose of what people need to know is the PCR and the antigen, and those are the two big ones.
I guess the way to say that I would just add to that is these are all mousetraps. Some are better than others, but they all catch mice. The antigen test is the one you take home. The PCR is definitive, but they all have their limitations. They can be falsely negative early in the infection, both of them. The longer you have symptoms, the more likely they are to be positive. That's kind of where it ends. A lot of people are, there's some role for getting testing after you've become ill to detect if you're still infectious. And that's a little misleading because what the tests need to assess is whether you're shedding live virus. And those tests are essentially restricted to research labs. They're not commercially available, not for any particular reason other than just they're laborious and expensive. And also you don't want to be handling live virus outside of a biosafety lab. So that's all I'll say.
We'll be wrapping this up here shortly. I have a couple more questions I want to squeeze in here. So Teresa, I'll come to you. If you would tell us just what could we be doing differently right now to help our community, if there's something that just sort of comes to the top of your mind.
Well, I like what Dr. Antonio said when he said, be kind. I think COVID kind of showed it forced us to change and innovate and do so many different things, but it also showed another side of our community, of all of us. And if we could all be nicer and kinder to each other as we go through this, we're all going through it together. We're all stressed. We're all in the same community. I like to say we're all in the same world. We all literally share the same air. Hence, we're all catching COVID together and we're all in this together. And it's going to take our entire village. It's going to take all of us working together to get us through this. We can't count on any one organization, any one person, anyone, anything. The government can't do it. It's going to take all of us working together, and we can do it together, being a little bit nicer to each other in the process.
Thank you. And Dr. Williamson, here's a quick one for you. How can people know when to seek help for COVID symptoms and when to treat at home? You get that positive test. How do you know what you should do?
Yeah, I think if anyone's starting to have increasing shortness of breath, the pulse oximeters that can measure your oxygen levels are so readily available now around different pharmacies and Walmart and Target and whatnot, or on off the web. So if those numbers are starting to go down below 90%, if you're starting to have chest pains, if you're starting to have neurologic changes, but if you feel like you've had a really bad cold, you've got cough, then just stay home, isolate, chicken soup, hydrate, common sense sort of things. But really, if you start having more shortness of breath or any other concerning symptoms like chest pain, neurologic symptoms, or dropping oxygen levels, that's the time to go into the emergency room.
Thank you. Okay, final question, and this will be a free for all. If you all would respond to this, that would be great if we can squeeze it in here. What is something that people don't understand or that you think they just need to know about at this point in time in our fight against COVID? What would be most helpful?
Well, what I would say is just keep in mind that the virus is the enemy. Your neighbor is not the enemy. The person who's vaccinated or unvaccinated is not the enemy. We're all in this together, like others have said. And if we just keep our focus on the virus, we're all trying to get to the same point. We're all at war with the virus. We have different ideas about how to best tackle the virus, but we're all in this together. And I think we just, we're all very tired, all of us in healthcare and out of healthcare, very tired of this. If we can all keep our focus on what it is we need to do to get this enemy defeated, that'd be great.
Thank you. Any
And
other final thoughts?
The vaccine is safe and effective, and the fears and the concerns that are out there, talk with your physician, talk to someone in your community that you trust. It's important to have support and to have someone answer any concerns that you have, but it is safe and effective.
Thank you.
And I think as evidence of that, if I look at all the docs I know, I have 2 children. I would never put my children at risk, and they're both vaccinated. My parents are vaccinated. I'm vaccinated. All of my physician friends were the very first in line to get their children vaccinated because, again, we've looked at the science, we've looked at the data, and we really know that this is safe and effective. So we would never put our children in harm's way, and nor would we anyone else's. So
thank you. I think we'll leave it there tonight. Thank you all for such an interesting, informative discussion, and I hope you've enjoyed our program as well. This Engage ICT conversation is sponsored by Susan and Leon Mader of Mader and Associates. I'm Sarah Jane Crespo. Thanks for joining us, and tell your friends and family that they can watch this conversation on our website, kmuw.org, under the Events tab.